Thank you, Secretary Bridges, my former boss, Secretary of Higher Education, and inspiration to everyone who does this work. I am here with Leslie Rios, a program associate here at the Hope Center, and we're going to talk about what's happening in the states to support basic needs security. And I want to start out just by noting that in a certain sense, it almost seems wrong to talk about state policy around student basic needs, because ideally, we would like to have a national commitment to meeting students' basic needs. But America has a federal system in which states play a vital role, in some ways, and in some places, the most vital role. So today, Leslie and I are going to explore how the states created an affordability crisis that threatens students' ability to afford their college education. And then we're going to walk through the ways in which state policymakers are recovering the ground for students and their basic needs in many different ways and working creatively to support students. And then we'll close by looking at how everyone in the Zoom room, can engage with policymakers to improve systems level supports for students. So let's start by talking about affordability. The most important big picture trend in affordability is the deterioration of state funding. Between 2001 and 2021, state funding per student dropped by 13%. So rather than investing in higher education, 37 out of the 50 states actually spent less money on higher education in 2021, adjusted for inflation, than they did 20 years earlier. And at the same time, housing costs continue to rise at well over the rate of inflation, putting additional pressure on students' bottom lines. And largely, although not entirely as a result of declines in state funding, tuition went up for both four-year public colleges and community colleges, again, well over the rate of inflation. These are all inflation-adjusted figures. And the results, I think you can see where this is going. A divestment to debt pipeline in which the amount of student loan volume tripled in the space of about 15 years. And so these are the overall pressures that students are facing. And so when we look at student basic needs, it is absolutely true that we know more about student basic needs than we did 20 years ago. And there is a greater consciousness of it. But it's also true that the problem that students face is worse today than it was before. The good news is that there is a lot of great work going on in states. We have legislators, we have agency heads like Secretary Bridges, and we have governors who really believe in supporting students. And we have higher education leaders who are articulating in a very visible way the needs of students. And so I hope we'll think of these policy innovations as inspirations, as models for what can be done in other states. So I'm going to start with SNAP. As I think everybody knows, there is a significant food insecurity problem at scale across our colleges and universities. But SNAP can help with that. SNAP provides subsidies for students to get nutritious food. And some states are leading the way. And I should preface this by noting that the federal government sets baseline standards, but there's quite a bit of latitude for states to interpret federal regulations. Massachusetts has in some ways gone the furthest by essentially extending SNAP eligibility to all community college students based on their interpretation of federal standards. And this has had some very important results for colleges and universities, because now they know that these students are eligible and they don't have to ask, are they eligible? Do they meet one of a set of complex eligibility standards? The answer is, yeah, they're eligible. And in California, they tried a different route. They have created a set of specific circumstances under which students would be eligible, having to do with whether the program, whether it be a program of study or a campus-based program, is increasing employability or has a work component. And they've established a procedure for letting the people who run these programs know whether their students are eligible for SNAP. And when I say eligible for SNAP, I mean eligible with no work requirement. And then finally, Virginia has focused on outreach, and they require colleges to notify students that they could be eligible. And the reality is that many students, possibly even the majority of SNAP eligible students, don't even know that they could be eligible. So taking steps like this to get the word out to students is really vital and valuable. Another key opportunity for confronting food insecurity is the hunger-free campus model, which essentially puts a set of interventions on the table, gives colleges a little bit of funding to use those interventions and to apply them, and holds them accountable for actually doing something and following through. And 7 states have implemented the hunger-free campus model, most recently Massachusetts. So let's hear it from Massachusetts. And I also want to give a shout out to the Swipe Out Hunger organization, which has been really a driving force in spreading this model around the country. In housing insecurity, this is, of course, one of the most difficult and intractable of basic needs issues, because housing is expensive and major forms of support are difficult to finance. And so 4 states have agreed to waive tuition for students who lack housing. And another 8 students require colleges to provide a liaison for unhoused students, typically alongside students who have been in the foster care system. And finally, I want to call your attention to Washington State, which has created a demonstration project to finance short-term housing for students. And this could be really decisive and valuable, and we're looking forward to seeing how that demonstration project works in implementation. But pay attention to it. Don't sleep on Washington State, because they're doing great work. And I'm now going to turn it over to my colleague, Leslie, to talk about mental health.
Thank you so much, Tom. So when we talk about mental health, in 2020, the Hope Center found that 2 in 5 students reported experiencing anxiety or depression at the height of the pandemic. And through research, we know that student basic needs also can impact the mental health of college students. And there are many ways that states can tackle mental health on college campuses. And today I'll briefly illustrate some different avenues that states have taken to invest in mental health. One way is through federal pandemic funding. One example of this is Connecticut, who established the Campus Mental Health Program, which provides grants to eligible institutions to drive innovative and evidence-based strategies that enhance student access to care and boost education and awareness of mental health services and programs. This was made possible through the Governor's Emergency Education Relief Fund. Because mental health can vary from campus to campus, this allows institutions to apply for awards based on the needs of their campus. Another example would be New Jersey's recent investment in community college students through the Every Minds project. This project takes a statewide holistic approach in supporting community colleges by providing training for faculty, staff, and students, investing in mental health and basic need resources, and strengthening partnerships among community colleges and community mental health providers. This was made possible through the Community Foundation of New Jersey Pandemic Relief Fund and Garrett Lee Smith Campus Suicide Prevention Grants. Another way has been through partnerships with the state's Departments of Education. Young Invincibles, Colorado, has partnered with Colorado Department of Higher Education, along with other agencies and organizations, to implement the Healthy Minds Campus Checklist. This initiative, similar to the Hunger-Free Campus Checklist, allows colleges and universities to earn Healthy Mind badges for implementing certain core programs and evidence-based initiatives on their campus. And the checklist was led and informed by students on campus. So by implementing this, colleges are working to break down stigma and enhance access to mental health resources. Parenting students are another focal point of our work. We know that there are roughly 1 in 5 college students who are parenting while in college, yet parenting students have often remained an overlooked group on college campuses. In fact, the Hope Center has highlighted that there is a lack of data collection on parenting students and their needs on college campuses. However, there has been some movement within states to ensure that they are collecting data on parenting students. Oregon is an example of one. In Oregon, a bill enacted in 2021 will require the Higher Education Coordinating Commission and post-secondary institutions to collect and report data on parenting students, while allowing each state student to identify whether they are a parent or acting as a parent or legal guardian. This will allow colleges and universities to understand who their parenting students are and provide targeted support. Additionally, the Hope Center advocates for better improvements to connect parenting students to basic needs supports, including public benefit programs. Many support programs do not reach enough parenting students as they should, but a recent 2022 bill in California ensures that on-campus basic needs centers provides information of not only CalFresh, but also California's Earned Income Tax Credit, WIC, and among other programs, and will provide information on-campus and off-campus resources to student parents and make sure that student parents are a priority population when signing up for classes. Targeting parenting students with information about available campus supports has shown promise. And then lastly, just connecting student parents to public benefit programs goes hand in hand with ensuring that the programs are actually supporting post-secondary education. So when thinking about federal programs like the Child Care Development Fund, which provides childcare subsidies to parents, state policymakers should use their considerable autonomy over things like copays and subsidy levels, priority populations, and most importantly, work requirements to best support a greater number of low-income college students. An example of this recently has been Washington, who removed the 20-hour work requirement for full-time students to allow parents to pursue community and technical or tribal college full-time, which will meet the work requirements. And so when we're thinking about reproductive justice, although institutions of higher education and the federal government all play a huge role in ensuring that abortion care is protected and students have access to the resources they need, there's also an important opportunity for states to come up with innovative solutions to prioritize the health and well-being of their students. Reproductive justice is a student basic needs issue, and states should be doing what they can to ensure that students have access to free on-campus reproductive health services where it remains legal, including access to abortion pills and contraceptives and clear guidance and communication to students. California is a state that is currently working on implementing their 2019 bill that provides public university campuses to offer abortion by medication. So although California is a protected state, it ensures that off-campus abortion barriers are reduced for students and could potentially help increase access to off-campus clinic capacity for those traveling. And then just lastly, in states where abortion is banned or limited, there's been a lot of conversation on ensuring students have financial assistance to travel. States should also think about how state emergency aid programs, which Tom will talk about in this next slide, and how those can be used to ensure students have access to emergency financial assistance to make the decisions that are best for them. So collaboration and support from state and college campuses will be important as students navigate this new reality. Now I'm going to turn it over back to Tom.
Thank you, Leslie. So I want to talk for a minute about financial supports. As we know, the federal government made a major commitment to provide emergency aid to students to help them get through the COVID-19 public health emergency. That funding is essentially exhausted. And while I think it's been clear that the emergency aid was valuable to students, they are now facing the exhaustion of those funds. And it's time for states to step up and to provide emergency aid because this aid, which comes to students when they need it, when they have an emergency, and it could be a number of different kinds of emergencies, that's the point at which they are really on the bubble between staying in college or dropping out. Minnesota and California have created their own emergency aid programs, which provide valuable supports to students. And this is worth the other states considering as well. Because not only SNAP, but many benefit programs are complex and difficult for students to take advantage of. Oregon and California have created benefit navigation programs. Oregon has established benefit navigators at each community college, while California has created basic needs centers. And these are really modeled on programs that colleges have been carrying out for many years. And they've proven to be very successful. They fit nicely within a holistic support structure for students, and other states should consider doing it. Illinois has also created a benefit navigation system, and will hopefully fund that system in the next legislative session. When we think about financial aid, we should think about how it provides support to all students. And at the state level, a number of states have restrictions and barriers on the support that they provide. For example, some financial aid programs are really only available for students who are recent high school graduates. And so New York and Illinois have a more effective system of grants, need-based grants that go directly to students and which all students can receive regardless of their age or their dependency status. And then finally, what's been called the shopping sheet. It addresses a problem that many students have, which is that they receive a financial aid offer letter from the college, and it's very difficult to make sense of it because they're not comparable and they're often filled with jargon. And so shopping sheets provide standardized, plain language information to students that will help them make the decisions that they need to make about the college that best meets their needs. Finally, let's look at what we can actually do to make change, because it can be very difficult from a standpoint as a student or as a staff person or a faculty member at a college or someone who cares to know what will actually make a difference. How can I get involved? So I'd like to start with just the basic goals. We often think about having to need a bill to get passed, but the truth is that the first goal is simply to ensure that policymakers understand what students go through and what their experiences are, both in class and out of class, because there are too many misconceptions about what students are dealing with. And then second, there are already programs to meet students' basic needs, to make college more affordable, to address their mental health needs, to address the needs of parenting students. But at the policymaker level, they don't necessarily know how well those programs are working. If you are in or at a college, you can provide that vital perspective to provide feedback to policymakers. And then finally, after those two, then we should look at new programs. What can your state do? Hopefully inspired by the examples that Leslie and I have just provided that would make a difference for students and meet their basic needs. And then in terms of what you can actually do, consider legislation, ask legislators to look at opportunities. Many of these opportunities are things that we know already work at institutions. And then pay attention to the budget, because where the budget goes, that is where the values of the state goes. Of course, make sure you're keeping in touch with the director of government relations or external relations at the college you're at, because they are going to have very strong views about the budget and the college's priorities. Look at what regulations are being written, because policymakers will often throw a victory party when a bill passes, but then the real decisions are made in regulation. And so be involved in that. And in implementation, as we just discussed, programs that look good on paper sometimes go off course in implementation. And then, if possible, meet your legislator. It could be the legislator who represents your college or your personal legislator. Let them know what you do and help raise their level of understanding about students' experiences. And then consider these tools: public testimony, There are hearings for these bills. Email, social media, use your social media responsibly, by the way, positive and constructive. Engage in coalitions and partnerships. Find out who your partners are out in the community. Use concise and compelling materials that will be meaningful to people, and look at your opportunity points. When does your state legislature meet? When is the State of the State address? Who are the policymakers who might take a campus tour? And what's happening in other states that you can use? And so consider these, and also reach out to the Hope Center, because we are here for you and we're ready to provide whatever help we can to make you successful in advocating for change to meet the needs of students in your state. Thank you.